But let's begin with the scrutiny on Canada's COVID-19 vaccine rollout. More than 420,000 doses of the Pfizer and Moderna vaccines have been sent to the provinces and territories, but less than 150,000 have been injected into people's arms. That represents about 0.4% of the Canadian population. Ontario, in particular, has been criticized for its slow rollout. It's administered less doses per capita than BC, Alberta, and Quebec. So what's the holdup, and when will things gear up? Dr. Isaac Bogoch is a member of Ontario's COVID-19 Vaccine Distribution Task Force. He's also an infectious diseases specialist at Toronto General Hospital. Hi, Dr. Bogoch. Good to see you, as always.
Good to see you as well. Happy New Year.
Happy New Year to you, and thank you for making the time. Let me start off with the announcement that was made by the provincial government in Ontario today, and that is specifically around vaccinating people in long-term care homes in the hot spots. The goal is to do so by January 21st. How confident are you that's going to happen?
Well, I'm fairly confident in that it can happen, and I think, let's be clear, that's the latest it should be done.
Right.
We should be aiming to do that much sooner. And I think that now that there's the actual vaccine supply that can enable us to do it, plus there's no shortage of people that are willing and able to work around the clock to get that done. I think that January 21st date is the latest it should be done, but we should really be aiming to accomplish that much sooner. This is an emergency. This is where about 75 to 80% of the deaths are happening in the country. We've got to vaccinate long-term care as quickly as possible.
What about beyond just the hot spots? Because I didn't hear a date today for a goal set to vaccinate everyone else in long-term care homes. We had Dr. Philpott on the show, Dr. Jane Philpott, former federal health minister. She said even with the doses we have right now, it is possible by the end of January to do so. Do you agree?
I certainly do. And I mean, it's still challenging because the doses or the vaccines are coming in on a weekly basis, but the real rate limiting step should be knocking on the door of the federal government saying, we're done, we've used up all our vaccine, can you please send some more? So I think one of the metrics for success here is really the speed at which you empty your freezers, the speed at which you can deploy all those vaccines into arms, especially at this point of the pandemic, in the most vulnerable of the vulnerable, which are, quite frankly, those who are living in long-term care.
So based on your experience, based on what you're hearing as a member of the task force, why do you think it is that things were so slow to start? Like, I don't know if it's one specific reason. We know that there was the issue over the holidays. There's dosing, things that had to be worked out. But like, is it a mistake? Like, were there mistakes? What do you think?
Well, I don't think the experience of Ontario is unique. I really think even if you look at the best place in the country, I think from coast to coast, it's just been too sluggish. And I think there's probably a combination of issues that are happening, and mostly are probably logistical and organizational, right? We were expecting to get vaccines sometime in the first quarter of 2021. They came sooner than that. That's a wonderful problem to have, but still, you've got to deploy them once you have them. And I think it's okay to have a little bit of wiggle room, right? You need some runway to get these programs up and running. But, yesterday, for example, in Ontario, we gave the first person their second dose of the Pfizer vaccine. That's 3 weeks. I mean, that's too long. We should have been up and running before then. And I think the next real test is how well are these programs going to perform in the next 7 days? Like by January 10th, how many people have been vaccinated? Have those freezers been emptied? Are the vaccines being deployed in the fastest time possible? And that's really the next test. And quite frankly, I'm fairly optimistic that, at least I know Ontario better, that they're going to do it because public health has been engaged, primary care has been engaged, the hospitals have been engaged. There's a good plan in place, and there's no shortage of people to administer the vaccine. So there's no reason to not exceed that January 21st goal.
What does that mean in layman's terms when you say public health is engaged, the hospitals are engaged, like people there are able to administer the vaccines? Is that what you're saying?
Yeah. So there's you have a vaccine sitting in a freezer and it's got to get into someone's arm. And it's not as simple as just someone just taking it out of the freezer and walking over to a long-term care facility and sticking it in someone's arm, right? You have to figure out which long-term care facilities there are, how many vaccines they need, how are you going to get thawing the -80 product, delivering it, who's going to go into the care facility, making sure people who are in the care facility have negative tests because you can't introduce COVID-19 into the care facility. What I'm trying to say is there are logistical challenges. They're not huge, but they still have to be addressed. And I think that by having long-term care, by having the public health authorities really helping drive this with support from primary care, with support from hospital leadership, and just having everyone aware of what their roles are, what their responsibilities are, you can actually finally start driving the truck. And I think this week we're going to see a rapid expansion of the program. But I really think that metric is, can you empty those freezers, right? We look at, numbers of vaccines per 100,000. We look at number of doses given. How much? There's only one supply of vaccine. It's coming from the federal government. If you can empty your freezers, you're doing something well. So I'm really going to be watching that closely.
And that marker you're watching for in 7 days, just to be clear, so our viewers are there, they should be paying, in 7 days, those freezers should be empty.
Yeah, I think another way of putting it is, you should empty your freezers before the next shipment comes in, and you should be emptying your freezers as quickly as possible. I
heard General Hilliard today say beyond the next shipment, there isn't certainty about how much comes in when after that. Can you shed any light on that? We heard the Prime Minister say today the supply will be there in the first quarter. Anything that we don't?
That one's way above my pay grade. I don't know much about that one.
But supply, is supply a concern from where you sit, or right now it's just emptying those freezers?
Right now it's emptying the freezers, and I want supply to be the issue. That's a good issue to have. That means you're deploying everything that you've got in an efficient manner. And quite frankly, there's no shortage of people that need these vaccines, and we certainly know the long-term care facilities in those 4 regions of Ontario that are hotspots. But let's be also clear, I like Dr. Philpott's assessment as well. There's a lot of long-term care facilities that are outside of those 4 regions. There's also retirement homes as well. There's a lot of heavy lifting that needs to be done in a short period of time. And I think, people often say, well, you know what, that's just a small piece of the puzzle. That's only, a couple 100,000 doses when you talk about those who work and those who live in long-term care. But that actually will do a lot of good, right? Those are the people who are dying. That's 75 to 80% of the deaths. That will at least significantly stop a lot of the deaths. It will also take some of the pressure off of the healthcare system. There's still going to be tremendous pressure on the healthcare system, but that will certainly relieve some of the pressure on the healthcare system. There's a lot we can do, a lot of good we can do in terms of lives saved, both related to COVID-19, but also in the broader healthcare utilization system. There's a lot of good we can do by deploying those vaccines as quickly as possible throughout the province.
Okay, thank you, Dr. Bogoch. I appreciate your time as always. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.